Hello, and welcome to our webinar on how to reduce wandering in patients with dementia during the COVID-19 pandemic, brought to you by the California Partnership to Improve Dementia Care. I am Dr. Jennifer Birdsall, a clinical psychologist with CHE Behavioral Health Services, and we also have Dr. Julie Futrell, a licensed clinical psychologist, also with CHE, and her kitty cat, who is our guest speaker today. So with that said, I am going to pass it over to Dr. Futrell, who will teach us a little bit about wandering.
Thank you, Dr. Birdsall. So I imagine that most of us know what wandering is. You know, it's that repetitive pacing that we often see with dementia patients where they just sort of do laps repeatedly over and over. It tends to be more common in middle to later stages of dementia. But it's pretty common. About 6 out of 10 people with dementia will wander, and it's not necessarily harmful if it occurs in a safe and controlled environment. However, it can be very dangerous, for instance, if they get lost, if they leave that sort of safe, contained environment, if they happen to, inadvertently put themselves in a dangerous situation by their wandering, or alternatively, if they negatively impact someone else's space, maybe by wandering into their room or something of that nature. But then during COVID-19, there's the added danger of germs being spread by people that are wandering, and all these infection control procedures that are so important right now. And that's really impacted by people who wander and touch things. So we want to look at sort of best practices to address wandering, especially during COVID-19. The first thing that we want to do is identify common triggers for wandering. Are there things that are making the person sort of get up and start pacing? Once we figure out what those triggers are, we want to address them in a very personalized, person-centered way. Part of that is providing appropriate supervision, being aware that someone's wandering, being aware of their patterns, and really being there to supervise. And then also reminding them and redirecting them, reminding them about not touching things, and we have to do that frequently. And again, just providing that higher level of supervision. So today we want to sort of look at some common reasons for wandering. You see them listed here: loss of memory. Sometimes they're searching for their past. They have a change in environment and feel really lost. They're anxious or agitated. They've got a lot of extra energy, which might be especially true right now during COVID. Maybe they're bored and they just start pacing because they're bored. Sometimes they're in pain or discomfort and the walking alleviates that. So we're going to go through some of these and then look at some non-pharmacological ways of dealing with that. So I'm going to turn it back over to Dr. Birdsall.
Thank you, Dr. Futrell. And so really what we're going to do for the rest of the presentation is just go through those 5 common triggers and offer some food for thought. So remember, really with each individual patient, we want to take their specific wandering case separately, because what triggers one patient to wander is not what triggers the other, and the interventions that work to redirect that patient or meet their needs so maybe they feel the impulse to wander less is going to be unique as well. So these are just some tips and strategies. So the first most common reason a patient will wander is, again, that loss of memory, searching for the past. They may set off to go somewhere, actually go, I'm thirsty, or have some, trigger for them to get up and go, and then forget why they left or started pacing, and then just start exactly what Dr. Futrell, that kind of just repetitive pacing, locomotive behavior. Or also commonly, they may be searching for the past, something they lost or they think that they've lost. This could be, for example, someone feeling like they need to get up and go to work, or they have to pick their kids up from school. That can be really common. So if we feel that this is what's kind of triggering someone to get up and move around and pace, what would we want to do to try to reduce that wandering behavior? So we, again, especially during COVID-19, can try to prevent as much, touching of surfaces and those kind of things. Well, again, we're going to gently reorient and redirect. If someone's confused, if they forgot why they were getting up, we're going to say, Joan, what do you need? Can I help you? Let's get you back to your room. I can get you something to drink. And we may have to do that numerous times throughout the day. That's why the patient is in our care. A lot of times wandering is what leads individuals to end up going to a care environment, because it's very difficult for their loved one to manage that behavior and keep them safe. So we're going to redirect, reorient, and try to meet their needs. Certainly keep their personal possessions in view so they don't think they lost something that they didn't. So the common things that they like to use, look at, we want to keep that available to them, again, in their line of sight. And certainly if we have to move them and you think, well, this is just a temporary move because of COVID, let's try to set up their room similar and keep everything in view for them. Definitely we can use memory compensatory interventions. These are things like calendars, whiteboards, letting them know where they are, who their care providers are, kind of writing that information down for them. And again, if they think, for example, they lost their daughter or they're trying to find their daughter because their daughter visited 3 days a week and now she's not there, try to meet that need. Have frequent FaceTime calls with family, schedule certain calls if we can, and try to give them activities that certainly give them purpose and keep them engaged. That can be very helpful as well. As I said earlier, a lot of times when they're searching for the past, it's a purposeful activity. We all like to feel that we have a purpose, that we're contributing, so we can have them do things that feel like a job and keep them engaged if we're able to come up with those creative solutions like folding towels, etc. Change in environment. This can increase because of COVID. If we have to change their unit, change their room, we might start to see some increased confusion, individuals wandering, really trying to seek and head back to maybe where their room used to be, a different unit, taking the path in the building that they're used to walking because that's kind of their implicit memory, what they remember doing for their 5 years of living in that particular space. So we really want to help them. Another thing with environment is that they may want to escape from a busy or overstimulating environment. And certainly during COVID, we may feel nurses are more hustling and bustling around. We all have to kind of, put on, take off our PPE. There's just a lot more commotion happening. So that may be a little bit emotionally distressing. They may be trying to escape that because they feel that turmoil. So what do we want to do in this situation non-pharmacologically? Well, certainly anything that we can do to help the patient feel that this is a safe environment, a familiar environment is important. So again, bring all of their belongings, put their photographs up, try to make the room similar, use any type of reorienting tools at your disposal, such as names or pictures on their room, on their door. Of course, we have to keep in our regulations and make sure, fire protocols, those kind of things, pacing things, but whatever you can do to reorient them would be very helpful. We may just have to keep, again, bringing them back, helping them learn their new environment, walking them back to their room, helping them get comfortable in that new space. And as best we can, if we think they're more trying to escape an environment that's uncomfortable, we want to reduce those triggers, right? Whatever's making them uncomfortable. So loud noises, commotion, those kind of things. When it comes to anxiety or agitation or emotional energy, this can also lead individuals to wander. I'm sure everyone watching this training has at some point had that experience where you just felt so unsettled, you just wanted to pace, it was hard to sit still. Actually moving about, doing physical exercise, we know that's a very healthy non-pharmacological intervention to kind of release some of that energy. And so that's very normal that someone might get up and just try to pace or move their body. And so here, when we think about it that way, we want to use non-pharmacological interventions, certainly to reduce their emotional distress. And in fact, we have a whole video in this series on how to reduce emotional distress. So I encourage you to watch that video. One thing we may want to consider though is, can we actually allow them to walk at some point in a safe way? Remember, as Dr. Futrell said, wandering in and of itself is not a bad thing if it's in a safe environment and we can keep it contained. So in terms of COVID, can we perhaps have a scheduled time with someone monitoring infection control, that someone has their mask on? Can we allow them to walk outside in the courtyard? Can we assist them in taking a walk and letting them actually move about and have that locomotive exercise behavior? Some facilities, for example, because they're not having communal dining and they have a big dining room, they've used that as a place where they can kind of have individuals walk, and they can kind of stagger the times of day where different residents can kind of use that area to keep that safe and within good infection control policies and procedures. That's really helpful. Any other stationary exercising, getting them some little like dumbbells, 2-pound dumbbells that are just theirs, or family can bring them. We can monitor them, give them some outlet for exercise, can be really, really helpful. So certainly anything we can do to emotionally help them cope with the anxiety, watch that video, but can we actually let them do that physical exercise in some way, because that can be actually quite helpful for anxiety. Boredom is a very common reason individuals wander, right? They're not stimulated enough. And every individual with dementia, no matter how severe, no matter what stage, we can think about some type of activity to give them, right? To help stimulate them that's not too cognitively taxing or would otherwise cause emotional distress. So we really want to think about activities. This is challenging now because of COVID, where we've eliminated those formal recreational activities we used to be able to bring residents to fill their time with some pleasant event. So now what we want to do is really think about ways to keep them engaged, that's meaningful to that individual, and that's something they can do independently. When we think about residents with dementia, what we want to remember is that, they may need help starting an activity. They may not remember what's at their disposal. Their family members could have sent a wonderful basket full of different activities for them. They may not remember that it's there. Even if they remember, they may have a hard time initiating that activity, getting it set up, finding that motivation to begin. That's part of our kind of frontal lobe. So that might be a deficit. And if their attention is impaired, if their concentration is impaired, they may need to shift from activity to activity more frequently, right? So what we want to do in this case, if we have someone that we think is wandering because they need a lot of, activities, we want to provide that to them. Hopefully you don't have a large number of residents who are wandering for this reason. So if you do just have a couple, we can do an individual care plan where maybe every half an hour, we pop into their room and we change out their activity, or we help them, right? So here's your photo album. Why don't you look through it? Maybe we talk to them. Then maybe we come back a half hour later. We say, would you like some music now? And then we come a half hour later and we give them maybe a puzzle or something to work on. And we try to engage them that way so that they can be stimulated, they can be satisfied, and we can keep them from wandering as much to kind of fulfill that need for movement or activity. And then discomfort or pain. So again, when we think about anxiety or agitation, that's like an emotional discomfort that can make us want to move. Certainly physical pain has the same effect. If anyone's ever had a significant pain, it's almost like you're not comfortable sitting, you're not comfortable standing, you just have to move around, right? Your body is trying to, help, because that movement in of itself can ease some of this discomfort, or, possibly that movement is for someone in a later stage of dementia that can't tell us, right? But that movement, that fidgeting, that pacing is a way to communicate pain. So if we think that pain or discomfort, and by the way, pain obviously is something we might think of as, traditional pain, but discomfort could be being in a soiled undergarment, or being hungry, or being thirsty, right? Some kind of physical sensation that's just really displeasing to our body. What we want to do in that case is first ensure that all basic needs are met, right? So if we have someone who's wandering, do they have access to drinks? Do they have enough snacks? Or, are we taking care of their thirst, their hunger? Are we changing them regularly if there's a potential issue around toileting, or are they a comfortable temperature, those kind of things? And then certainly we want to do everything we can to identify any cause of physical pain or discomfort and treat it appropriately. This may be one where, in fact, we want a pharmacological intervention. I know this talk is about non-pharmacological interventions, but certainly we want to bring in their PCP. We may have to bring in a pain specialist. We want to make sure they're on the right regimen, but then other things we can do to limit their pain, right? We can talk about each particular patient with the team, whether it's, moving, repositioning, ice packs, heating, all of those different things. We want to make sure we're really taking care of their pain. And if they're more comfortable, then we would see a decrease in wandering. Lastly, what are just some other general interventions to help us really manage wandering and infection control during the COVID pandemic? Some facilities, if they do have someone that tends to wander, but they want to limit how many spaces that person can get into and touch surfaces, have found that if you camouflage doors by painting them the same color as the walls, may not be as visually appealing aesthetically, but that actually can, what's the word I'm looking for? Prevent the individual from going into that room because it doesn't look as enticing. It doesn't look as like it's an opening or somewhere else to go. Certainly some facilities also use those stop screens around. If this can be really common if you have someone that was in a room and they were in that room for 5 years, and then you had to reposition them and they want to keep trying to go back to their old room, that stop screen can really prevent that, because no matter where we are in the stage of dementia, all of us have a very good implicit long-term memory of stop means go no further. So that can kind of redirect them. Certainly we use devices to signal if a door or window or some space is open where we don't want the patients to enter. But realistically, as Dr. Futrell said earlier on, we may just have to up our supervision during COVID, right? Really watch what residents are doing, do a lot more redirection, reorienting, so we can decrease where they're headed, where we don't want them to go, or really monitor surfaces that they're touching. We want to help residents use PPE to wear their masks. That's really, really important. Potentially wear gloves. I don't know if that really helps with infection control or not, but we really want to make sure we're limiting any type of spread of germ. And we are going to have to just clean and disinfect so much more. And I was watching a webinar with an infection control specialist, and she recommended in memory care units or dementia units that every 2 hours, staff are cleaning highly used surfaces like doorknobs, handrails, at least 3 times a day, but every 2 hours would be ideal. And we can really help with our residents by helping them wash their hands, very frequently, particularly those who are wandering. And so that is our topic on wandering today. Thank you so much for your time and participating. And if you have any questions, the contact information for my email is below. We're happy to answer questions. Thank you.